Alright, so the patient that we have today is a 22-year-old male complaining of shortness of breath on a construction site. So the first things that we need to do is determine if the scene is safe. The scene is safe and we need to proper PPE, so I would suggest gloves in this situation. I don't have gloves, but we're just going to pretend that I have gloves. The next thing that we want to do is request ALS support. Currently ALS support is not available. And then just generally as we're going up on the scene, we just want to see if there are any spinal injuries, any injuries to the head, any traumatic bleeding, stuff like that. All that stuff is good, we have none of that stuff here. So the nature of the illness, the patient is complaining of difficulty breathing. And they do appear to be in a good amount of distress. Another thing to assess is the level of consciousness. He appears to be alert, he can talk, everything like that, just is having difficulty breathing. Like I said before, chief complaint, difficulty breathing, airway swelling, rapid heart rate. So another thing that we want to do is take the vitals. So the assessment here says that his heart rate is rapid, so we just want to keep assessing that. He has a pen airway, so there's no need for to secure an airway of any sort. Assessment of his breathing just by looking and hearing. It's rapid, irregular, there is some audible wheezing, and he can only speak for a few words at a time, so it's very labored. And just looking at the patient's skin, circulation, he is pale, cool, and clammy with a weak and rapid pulse. So with that keeping in mind, we want to keep assessing his heart rate, his blood pressure, things like that, to make sure that he doesn't go into shock. So the patient was eating lunch when he was stung by a bee. Apparently the patient has a history of allergy to bees. It happened about 20 minutes ago. The patient does have an EpiPen. It is not specified whether or not he's used it or not. So with our secondary assessment, it says that he has hives appearing on his body. The patient has a large welt on his back of his neck with what appears to be a detached stinger from a bee. So at this point, we can assume that the patient is allergic to bees and he got stung by a bee. Again, I'm not sure if he used his EpiPen yet, but I would say that at this point, we would want to call on a doctor and ask if we can administer an EpiPen. So once we get clearance on that, we would administer the EpiPen. I would say probably wait about 5 to 10 minutes, see if anything happens. If it doesn't happen again, I would say give another round of Epi. If that doesn't work, we would transport him to the hospital. And that is our assessment.